Okay. Let's see. Welcome to Conversations. My guest this afternoon is Brant Goode. Brant works at the health department with infectious diseases. He and I are also co-chairman of the Regional Advisory Committee on HIV Prevention, which is a mouthful. Maybe we'll talk about some of that. But I want to talk about other issues today. I don't know if I've ever told you, but when I was younger and read everything that came my way, I read a book called Man, Nature, and Disease by a guy named Sherrington. And it was really a wonderful thing. He talked about diseases from the disease's point of view, and that people were sort of like big hotels where diseases checked in, and that they had lives of their own, and it was a fascinating thing. I remember malaria being a disease that really got to me. So let's talk about some of these. AIDS is big, of course, right now, but what is the biggest killer in the world today?
The biggest killer in the world today is malaria. Still. And it's followed close second by tuberculosis. These are two diseases we don't hear much about in America right now.
What about for America now? Are those?
No, most Americans are dying of lifestyle-related things like heart disease, stroke, cancer. We're living long enough to develop these problems. People in other parts of the world are still dying of infections.
What about tuberculosis here in America?
Well, in the 1800s, people died of TB a lot, and we have actually a lot of literature left behind. People who had TB and wrote as they were dying in passionate ways, people like John Keats, the Bronte sisters, a whole host of people. That trend of people dying from tuberculosis went away starting earlier in this century and then has declined steadily onward. But occasionally we see cases of tuberculosis still. Sometimes it's people who are elderly, who were infected a long time ago and finally are getting sick with it. And the other group of people besides elderly who have tuberculosis in America today are people who were born in other parts of the world and came to America as either immigrants or refugees.
Let's talk about, say, malaria. Now, that I know it lives in mosquitoes, and then it goes into a person's bloodstream, and then it goes into the blood cells and lives there.
Right. And then another mosquito or several mosquitoes bite that person with the infected blood cells. Those mosquitoes then become infected and can spread it even further.
The thing that fascinated me about this was are there parasites?
Yes.
And they live in the blood cells. And at certain times, they all, together, they break the blood cells, they go out and reproduce. And that's what causes these periodic fevers that come almost like clockwork.
Right, and the blood cells themselves breaking apart creates, I guess you could call it cellular debris in the bloodstream, and it can clog up various organs, including brains or lungs, any organ system with a bed of capillaries. That cellular debris will collect in and cause significant health problems.
So diseases are sort of what we call things that happen. I mean, there are all kinds of microorganisms in our bodies, and disease are what we call them.
That's a great point. The fact is, most other organisms, whether they be viruses or bacteria or parasites like malaria, most of them don't cause us any harm. And you're right, we have many of them living in us and on us. Only a handful cause us to become sick that we would then call diseases, like tuberculosis, which is a kind of bacteria that leads to infection, and then occasionally that infection causes whoever has it to become sick. Malaria, the parasite is injected by the mosquito, takes up residence in this grand hotel, and feeds off of us, reproduces, and then will cause us to become sick. But most of the organisms out there don't.
Well, it's not to their advantage to kill their host.
No, no.
And some of these diseases, as I understand, mutate and become milder.
Right, or you could talk about it in a sense as a step forward in evolution if they mutate and become milder so that they don't kill their hosts, and their host lives and the bug within the host lives.
Any chance that that could happen with AIDS? Or
Well, that's a good question. I don't know if that could happen with HIV, the virus that causes AIDS. Right now, it's a parasite that usually takes a while to kill its host. It doesn't happen right away like some of the other things that garner headlines, like the Ebola virus, which kills people fairly rapidly. It's possible that maybe many generations away or in the future, people will have adapted, or HIV will have adapted to people enough so that it won't cause as much illness. One of the problems, or one of the ways to perhaps predict that, is how recently an organism became a human pathogen, something that could infect humans. And apparently with HIV, that was fairly recently. Maybe if we could go back in time thousands or tens or hundreds of thousands of years ago, we'd see similar viruses that were doing something similar to people, that just over the period between then and now, both the viruses and the people will have adapted well enough to each other so that they can live more or less without hurting one another.
Let's talk a bit about emotions and, how would you call it, the image of diseases. Have you read Susan Sontag's book on the nature of disease?
I've read pieces of it.
She talks about...
And did she write illness as metaphor?
Maybe that was... Okay, it was on the nature of photography and illness as metaphor. And she talks about diseases having certain class of chic and not chic. She talks about TB was very chic, very poetic. And,
right, when we still live with the examples today, when you think of goth as a style, you know, these people who wear lots of black and they look fairly gaunt. Sometimes they even wear white makeup, almost corpse-like appearing. Goth is very reminiscent of how people looked when they were dying of tuberculosis. They were thin, they were pale because they would be coughing up a lot of blood. And the passions that I mentioned earlier, that when people were dying from tuberculosis, they didn't die quickly. They usually had some time to ponder their future and their fate. And when people do such things, it often heightens their sensitivity and perhaps even their ability to be creative. And so for tuberculosis, there is this legacy that we have now still of, I think, young people in particular, wanting to be very creative and yet passionate, and to gain some degree of notoriety for how they look and how they behave. And goth, I would say, is a legacy of tuberculosis's style.
I was wondering where you were going to go with this goth thing in there. Now, she wrote her book pre-AIDS, and she talked about the fact that cancer was a disease that didn't have that kind of cachet, that cancer was sort of kept secret. And well, I remember even when I was young that it was referred to as the big C, that it was not so much talked about, and that caused problems with it actually being treated, right?
Well, there's a lot of fear associated with it. Treatment was not very helpful. Often it involved surgeries that could be very disfiguring, and I think a lot of fear created the stigma of cancer. And indeed, people, because of that stigma, probably avoided seeking care for things that might have been able to be helped if they had gone sooner.
And now cancer is, kind of neutral, I would say.
Well, I don't think I'd go that far.
Really?
I think there's still plenty of stigma associated with cancer.
In my mind, there isn't. Let's talk about AIDS. AIDS is one of those diseases that has an image because it was associated with homosexuality. It was sort of a very taboo, and still is to an extent, a kind of taboo disease, even though we know all kinds of people can get it. Has that caused problems? I mean, the image of it.
Well, certainly. It's been very difficult, I think, to do good prevention work, particularly with marginalized groups, culturally marginalized groups like, for example, gay men who have borne most of the burden of the epidemic in our country. That's changed, and a lot of it has to do with the power of that group coming together and deciding that they needed to take care of it as best they could. Sometimes I think doing a much better job than even the organized public health infrastructure was able to. Self-help.
Now, I'm HIV positive, so I can speak with some authority on this image thing. I know when I first was diagnosed, I didn't tell anybody. I mean, for a long time, it was something that I kept. I mean, there were a few close friends, but other than that.
Why is that?
Well, because at that time it was in the news that kids weren't allowed to, swim in swimming pools, and people's houses were burned because they didn't want kids in town, and it was. I don't know. It was very strange. I had no trouble coming out as gay, but there was something about that disease that kept people really more closeted than they were with being gay. And it was only, gosh, I would say 6 or 7 years after that I started realizing that the only way to get over some of the fear was to talk about it openly. And
analogy there with homosexuality and coming out issues around being gay, which still has stigma, although I think it's improving in our culture in particular. It's easier to come out, I think, now than it might have been 20, 30 years ago. Same with HIV. There's panic associated with certain diseases, and HIV created early panic in all kinds of different groups. Even supposedly well-informed groups like healthcare workers would overreact to the epidemic, take precautions that were not sound or indicated through even the early evidence of how the virus was and was not being transmitted. Outside of health professionals, certainly lots of other people panicked, I think, about HIV, further marginalizing the people who were infected, be they gay or not. Issues around neighbors not talking anymore, or even violence against people who were infected, excluding students from schools who were HIV infected. That kind of panic, I think, has died down some, but we still live with that, and that stigma.
Recently there was a documentary on PBS on the flu, the Asian flu in 1919.
Right, it's actually the Spanish flu, 1918, 1919.
It wiped out thousands and thousands of people, and because it was airborne, it was, it spread like wildfire, and people just dropped within days.
Right.
And talk about panic. People would set up armed guards at the edge of town and wouldn't let newcomers in because they were so afraid of it. And
right, and curfews. There's a long-standing issue in public health about the public welfare and individual rights, individual members of a community, and their rights to be able to go about their daily activities, whether they be out in public or selling food, and then the public's right to be protected from undue hazards. And sometimes things have not always worked the way, in hindsight, they should have. And panics are a good example of that. I'm trying to think of good examples besides healthcare workers and HIV. The Tuskegee syphilis study is one where I think ethically nowadays people easily recognize how wrong it was not to offer some treatments to people simply in order to study the natural progression of an illness. The logical argument posed was that we need to know about this illness's natural progression so that we'll be better able to deal with it. But the price was to let people become ill and suffer through that and simply be observed. And that's, I think, these days something that would not be acceptable. Other issues of personal rights or liberties, versus protecting the public go on and on. If a business is implicated in the spread of some disease, whether it be a foodborne thing with a place that serves meals or sells food for people to take home that might have been contaminated, does the health department have a right to go in and shut that individual business owner's enterprise down, harming them in order to protect the wider community from becoming ill and incurring whatever illness costs might be?
I know in San Francisco there was a big to-do over closing the bathhouses.
Right.
Now, for up here, it's no big deal, but down there, bathhouses were places where people went to meet people to have sex. And the bathhouses were considered almost as a symbol of gay liberation.
Right. And there was a lot of protest
We're past
about
that.
closing them.
I think the gay movement's past that point. But at the time, it was like almost like saying to people, go back in the closet, close down this institution that you've built up. And so there was this conflict of public health as opposed to, individual freedoms. In the United States now, who runs all of this? The CDC, Center for Disease Control, is that?
They're part of the Department of Health and Human Services, which is part of the federal government. I believe it's part of the executive branch, although I'm sure there's somebody who could take me to task if I don't know my government administration as well as I might. But they are funded each year through congressional budget setting policy and procedures. A bill is signed, and some of that money then goes to the Centers for Disease Control and Prevention to do all kinds of public health related work. They're not the only entity involved in public health, but they are the main entity involved in communicable disease control.
And they're open to political pressure, right?
Certainly.
In other words, you and I have dealt with this issue that we would like to see people be able to get sterile needles.
Right.
But because, people in Congress think that that would be encouraging drug use, it's a taboo. You cannot use government funds to do that.
There's federal prohibition on
that's
it.
just one example of the kinds of things.
Right.
And especially with AIDS, there was this problem of the government not wanting to spend money because it was a gay disease.
Right.
At least at first, that was
Right.
the feeling.
One thing I think you could always say is true about public health is it's always political health. The political climate and the various degrees of which it may be healthy or not impact how well public health is funded, as well as what directions are emphasized in public health. The early history of AIDS in America is not a good one in a public health sense. The public health professionals knew what was going on, had good ideas about what to do, but they could not persuade political leaders to make moves quickly enough. And there's been a lot of criticism, for example, the Reagan administration's lack of early movement. Ronald Reagan appointed C. Everett Koop to be the Surgeon General. And finally, Dr. Koop said, we need to do something. And everybody got something in the mail from the CDC about AIDS. But that was a bit late in coming. And one has to wonder how many people would be alive today, how many fewer infections we might have if the policymakers and the politicians had been more willing to address this issue earlier when they heard about it from public health professionals.
It is my impression, and I want to ask you about this, and it may just be because I've got involved in this on a deeper level, but has the CDC become much more powerful because of AIDS? Or is it just that the CDC seems bigger to me because I know a lot more about it?
AIDS has driven a lot of CDC activities since funding began in the epidemic. Once there was recognition that this is a tremendous problem, funding did begin and CDC grew to help try and address it in ways that were meaningful. Along with that, though, I think another way that the CDC has become more, has gained notoriety is just that in general, people are aware of HIV and AIDS and other diseases. And HIV has driven that. HIV as an epidemic has scared enough people or heightened awareness about various kinds of infections in ways that other public health issues haven't. And so CDC has benefited, and I think we all have, from greater awareness in general about infections, and most of that's due to AIDS and its frightful appearance.
Well, it occurs to me that maybe it isn't just the fact that I deal more with, the CDC, but that you hear about it on television.
Right.
It's part of drama shows,
Right.
A mysterious disease pops up on, say, the Profiler or something, and they contact the CDC
And usually, I think in those types of shows or in books, these professionals from CDC come in and do some fairly heroic things. They're protagonists, they're helpers. And that, I think, has been a real boon for public health in general to see themselves in a positive light.
Let's just, for fun, and I know maybe we shouldn't, but let's talk about the positive things that AIDS has brought about.
Sure.
For a minute, skip the fact that a lot of us have died. I know for the gay movement, I think it has really brought us together. Having to face the fact that so many of us were dying at such a young age has pushed the gay movement into a kind of concern for spiritual values that was never there before. So it has also brought the gay community out in public a lot more because, you could stay in the closet and not tell your parents that you were gay and get through your whole life, but you couldn't stay in the closet and not tell your parents that you were dying, in a short amount of time.
Yeah, although a few, I'm sure that's happened and it's been very sad. But you're right, AIDS has done some positive things, despite all the mortality.
What about scientifically? Investigating AIDS, has that given us tools for other diseases? And
I think there's two separate tacks I'd take on that question, Greg. One, the social science aspect, how to help people change behaviors in order to be healthier. And that science has been driven, I think, in great part because of the desire that the money that is being spent on HIV and AIDS prevention, making sure it's being well spent. And so are these things that we're trying to do to help people be safer working? Why are they working or why not? Those are social science types of things. And there's been, I think, a lot of progress that we can credit the epidemic for helping with. And certainly the other is in the more hard science, medical science, virological stuff, things that are very, very technically oriented. That science is going great guns as well.
I want to ask you now about your job specific. Well, I tell you what, let's talk about the health department overall in this county, what they do.
Okay. There's three main arms to the health department. There's a maternal child health arm where people can go for supplementary nutrition, or they can get care for infants, or during pregnancy they can get referred out to medical professionals to help take care of them during that pregnancy and after the baby is born. If they're families with young children that need some assistance, they can often find assistance from health department field workers, either public health nurses or social workers who go out to visit families and try and help them function at a higher level. That's the maternal child health arm of the health department. Another very significant arm of the health department that I think most people are aware of is the environmental health part. These are the people who work to make sure that the air we breathe, the water we drink, and the foods that we consume are safe.
That's in the health department as well?
That's right.
Oh, I didn't know that.
That's right. They monitor the air quality and will call alerts if there's too many particulates in the air. They'll monitor water quality as well, and if there's a problem with the municipal water supply, they'll work to alleviate that. The way it usually hits the paper in a big way is if there's a significant threat that might be a risk to public health, that then people are advised to either boil water or something like that. They do a lot of work, and I think a fair number of people, particularly folks who are building new structures or building homes, have to deal with that division of the health department if they want to connect to a sewer or put in a septic system. Another part of the health department is the division I work in. It's the health promotion division. And we have a collection of programs, one of which is the tobacco control program, trying to help people avoid starting the use of tobacco. And that certainly has gotten a great infusion of resources lately because of the settlement with the big tobacco companies. Another arm in that division, in our division, is traffic safety, trying to keep people safe while they drive, whether it be by wearing seat belts or avoiding drinking too much and then driving, getting a ride home if they have had too much to drink. That's the traffic safety program. Another part of the health promotion division is just kind of taking the pulse, if you will, of Missoula County and seeing what the various types of health indicators are. How long are people living? What diseases are they becoming sick with or dying from? Monitoring those things and seeing where public health resources might be directed. I'm a little piece of that division. I do communicable disease response. There are certain infections like hepatitis or soon HIV itself will be reportable to the health department. This is not a new thing by any means. It's mandated by law that certain types of infections are reported. I work very hard to make sure that people's privacy is protected. I certainly cannot go and talk to people without having some reason to inform them about a potential communicable disease risk that they may be facing either through contact with a person or through consumption of a food or any number of things. Attendance at a child care center.
How much of your time do you spend on HIV?
I spend a quarter of my time on HIV. That's the other part of what I do. And what it is, I really wanted to focus on the prevention end of things. For a long time in the health department, we also tried hard to deal with the after people are infected side, what can be done to help them achieve high quality life, whether it be getting medical care, high quality medical care for their infection, or if they needed social supports and housing or assistance for food. Those things have now moved on to other parts of the community. And what remains in our division is strictly called prevention, HIV prevention. We receive funding from the state health department to administer to the local area, which is not just Missoula County, but it's also Ravalli, Mineral, and Sanders counties, to try and put interventions out there that help people avoid becoming infected with HIV. And you're a part of that.
Yeah. I was going to bring that up. But before I get into the RAC and how you and I work together, how is the health department funded? I mean, we say it's that public health is political health, but
Right.
does the health department change with the mayor? How does it get money? How do I affect it?
Okay. Oversight and budgeting issues are through the administration into the health department, and our director of the health department right now is Ellen Leahy. I asked Ellen a couple weeks ago about funding at the health department. Right now, I think she said 23% of the budget is tax-based. Tax dollars come to support it. And tax dollars are not unpolitical or apolitical by any means. We live in Montana. We hear a lot of talk about how taxes maybe should be more closely scrutinized before they're raised, maybe up to a vote of all the people to decide if they should be raised or not. And so certainly that portion of the health department's budget is in a political arena, whether it be from the entire state or more locally with county commissioners, as well as the mayor and city council. The rest of the funding is various kinds of grants that might come in and help feed into the process of providing services to the community.
I see. Well, that is a lead into the RAC. I said before, you and I are co-chairmen. You represent the establishment, the health department. I represent the civilians.
Right. And I like it. I like that acronym in a sense. It's kind of a military acronym,
Right.
but it's somewhat
The
fun.
RAC, we used to be the Hawk, but
Yeah. Well,
we
you're
changed that.
the civilian co-chair.
Oh, I see.
Kind of like the Secretary of Defense is a
all right.
civilian, and then the
Basically, what we do the CDC, or the federal government, through the CDC, gives out money to the states. And it is mandated that that money to be spent has to have two controls. One, establishment health departments, and one, sort of civilians have to take part in that. And therefore, committees are mandated. I mean, have to be formed.
Right.
This isn't something that we did because we wanted to. It was something that, in order to get the money, it has to be done. People have to do it.
Right. Early in the epidemic, and when the funding had been going on for a while, it wasn't that way. There was no community involvement required. It was that the health departments got the funding, knew what they were supposed to do, or apparently knew that, and then went out and did it. It didn't work as well as it should have because there wasn't as much input from the people who were affected by the epidemic directly. And I think much to the credit of those people, they organized well. And you alluded to this earlier when you talked about how one of the actual positive outcomes of HIV and AIDS is that it helped the gay community organize around an issue and become more powerful, to find a voice. And that voice has led to a requirement now for community input into how these funds are spent. And I would say, yeah, it's a partnership in a sense, but I would actually say that the community planning process is very strong. There has to be concurrence within the community planning partners that what the health department's putting out there is indeed what should be going on. That happens regionally as well as statewide in Montana. You know, you've been involved in the RAC, or the community planning process, now for a few years. And I've gotten to see how it works and see kind of the political nature of it.
And sometimes it can be downright political. And then there is what we call the SPG, the State Planning Group. You and I go from the local level here, representing, you know, kind of being the leaders locally. Then we go to being two of just many from across the state.
Right.
And there's a whole state plan that goes on that
Right.
approves of local plans and
Right, it incorporates the local folks' input. And so another way that they're trying to be true to the spirit of involving the community is to listen. And the local players, like if we go to one of these statewide planning group meetings and we have a good idea or we have a problem, that's the forum for those things to come up. And they have to be addressed. We can put whatever we want on that agenda.
you know, sometimes I find those meetings very boring. But you know, in light of what we've talked about here today, some of these little old ladies, and well, some of them aren't so old, but some of these little ladies from the hinterlands of Montana, I think that sometimes maybe that's the first time they've met a gay person. They don't have much AIDS in their counties.
Right.
They don't have that many openly gay people, but because of this disease, which we all face, they all come together, and I should enjoy it a lot more than I do.
Well, and I think
we have a policy where we go, in order for us to be aware of what's going on across the state, we have meetings in some of the most, well, small places, let's put it that way. We've gone to
Lewistown, was it Glasgow? Well, and all over.
Yeah. Get to know each other better on these long trips. And, yeah, it is, maybe it pays off in a sense.
Yeah.
Brant, I want to thank you for coming here today. If the show continues, I'd like to have you back. We can discuss some of these issues as well. HIV is a big gay issue, and it's a big national issue as well.
Right. Well, can I plug a couple things then?
Yeah, certainly. If you want to plug some things, I should have known that you would.
Well, let's plug community planning.
All right.
Our RAC, our Regional Advisory Committee for HIV Prevention, is always looking for new blood. Anybody is welcome. These are public meetings. These are public funds that we're trying to decide how best to use for the biggest impact, the biggest bang for the buck. And it takes people from the community to help us figure those things out.
We'd especially like gay people and HIV-positive people.
And people who have either in the past or currently have issues around drug injection,
yeah.
Okay? And we also need young people. We need people of color, certainly, to help us be more efficient in how these dollars are best spent. The meetings are advertised in Outspoken, in the Missoulian, in the Independent. They can certainly call the health department and ask, or they can call you and ask.
I bet we can put some numbers underneath this.
Sure.
Edit them in.
That would be good to do.
Okay.
Okay, and so input from the community. And even if you don't want to come to these meetings, which, you know, sometimes they can be boring, although every now and then we do have some more entertaining or interesting.
We're trying to make them more interesting.
Right. Even just a phone call to let us know what you're thinking about these things really does help. That's one way that we get input from people that otherwise they may not want to show up at a meeting, and that's okay. We can still bring their comments or thoughts to our meetings. Another thing about HIV prevention to plug is that there are a lot of things out there that people can do. I always like to say that the most important sex organ is the one between our ears, and it's certainly attached to our ears, and it's our brain, and using it to communicate well, using it to think about things, using it to increase the likelihood that if we're going to engage in some activity that might be risky, that we think more about that and we engage in those activities in a more thoughtful fashion. If you want to talk to people about that, you can do it anonymously. You can do that through the Missoula AIDS Council, Partnership Health Center, Planned Parenthood, Blue Mountain Clinic, Missoula Indian Center, University of Montana Health Service are, I think, the main widely available places that people can go, but certainly phone calls, again, are available to anybody who wants to make either a local call or an 800 number. Call if you have questions. Call if you have thoughts about these things. Along with that, all those places that I just mentioned also offer anonymous testing for HIV. If you want to know your status, that's a good way to find out. Various places offer them for free. You can call and find out about those things. I don't think it'd be good to not talk about this topic without addressing that.
Mm-hmm. Well, then I'm going to plug something as well.
Good.
And that is talk to your kids.
Oh, thank you.
I'm pretty well convinced that anyone past, say, 22 knows they should wear a condom. And if they do or they don't, there are other issues involved. But we get new kids coming up all the time. And it was wonderful to see your daughter come to a conference I held representing the Hellgate Gay Straight Alliance. They don't identify themselves as gay or straight. They come, they meet.
They're humans.
Yeah. And they came to this kind. I thought it was wonderful to see kids that young get into it. So if you have kids, talk to them about sex and talk to them about HIV.
Yeah.
Because this is not a question of a disease that's for gay people.
Right.
And it's bigger also than HIV. There are other, you mentioned hepatitis, there are all kinds of diseases as well.
Right.
And kids need to be made aware of that.
And to think about kids, again, that's such a great point to bring up as far as prevention and long-term bigger bang for the buck. That's where it is. The sooner and more effectively we can reach young people, the longer the benefit of that kind of impact. Kids sometimes don't want to talk to their parents about things. Sometimes parents don't want to talk to their kids about things. There's all kinds of interesting dynamics there. Find other trustworthy adults to talk to. Teachers, counselors in schools, parents of friends that seem approachable. And for the adults in the community, be approachable. Be willing to just take a breath when you hear one of these questions and not reflexively say something. Think more about it. Think about, here's a kid that's probably out there a little bit on a limb that deserves some credit for taking a risk, and maybe acknowledging a good question before saying, don't you ever do that, or whatever they might impulsively want to say.
And it might be a good idea, too, for parents to let the school districts know that they support sex education, HIV education, because in some places it's hard to get that message across within the school districts because the school districts assume that the parents are all uptight about these issues.
Right, and I think, I guess we can go off on a bit of a tangent. I think the schools are in a hard position. They don't want to do a poor job educating their student population by any means. They want to do an excellent job. But there's a few people out there who don't want certain topics covered. HIV is sometimes one of those topics. Abortion is one of those topics. Contraception is one of those topics. But most parents, I think, do want schools and other people to cover these topics in ways that are good for kids. I think that most parents really do want those kinds of things to be covered. I think most parents understand that covering them well does not lead to more kids going out and doing things. It actually works the other way around. It leads to kids going out there and doing things that are safer or waiting to do things that are risky.
Well, Brant, thank you very much for joining me today. This show goes on. I'd love to have you come back and discuss some of these issues with me.
You bet.